Welcome to Nursing School Explained and this video on implanted ports or Mediports, which are part of the central line family. And those Mediports or implanted ports, they are used for long-term only. And this is usually used for patients that require chemotherapy at regular intervals, where we don't want to have anything exiting the skin and put them at risk for infection. So these ports are implanted underneath the skin, and then we can access them as needed for whatever therapy that they need. And the procedure of the insertion is usually done in the operating room or the procedure room where sterile precautions can be ensured. And then the reservoir of the port of that disc sits underneath the skin, and it is usually very easy visible in the patient's chest, where it usually sits either left or right side. And then a catheter that comes from that port connects the port to the central circulation. So if we look at it over here, we have our patient. The disc right here is that implanted port. In blue is the subclavian vein. So this port sits underneath the skin. If I run my hands over it, I could feel the port underneath the skin. And then what I can't see is the catheter that runs from the port, from that reservoir into the patient's subclavian vein, into that central circulation. So from a side view, I have a little example here. So if this is the disc, that's probably a pretty good size. It's from my camera. So it sits underneath the patient's skin. It's a disc that looks like this. And then on the top, it has a rubber port, which is where the needle goes through. If we look at it from the top, it's that disc just like that. And the big circle in the middle is that rubber port. And actually, when you palpate the port, you can feel the rubber. It's a little bit more pliable than the metal disc that surrounds that rubber port. And so now if we look at it, that port is inserted like this in the patient's chest. And in order to access the port, we need a special equipment, a special needle that's also called a Huber needle. And the Huber needle is a special needle with a 90-degree angle. So it usually, the needle looks like this. So if we access it, it goes like this. There are different gauges available as well. And then the needle itself, just like a regular IV catheter, hooks up to the line, and then we have a little access port, a little lure lock here at the end. It usually comes just with one tail or one port. And then once we access the port, because we have that reservoir there, it is always recommended to either have a continuing infusion or flush the port at regular intervals with either saline or heparin, depending on your policies and procedures of the facility. So make sure that once you have been certified to be able to use the Huber needle, which is usually also a sterile procedure because it goes into the central circulation, that you know what the policies are in terms of continued infusion and or flushing, and what to flush the port with. So it might be the case that the patient who has an implanted port, who receives chemotherapy on a regular basis, is now admitted for another reason. But because they're already high risk for infection patients, and because we have that central line access, we might as well use it, but then we have to make sure we follow all the precautions to keep the port going and make sure it doesn't clot off, because otherwise the patient will have to have that port removed and another one inserted for their continuing chemotherapy. Thanks so much for watching this video. Also check out the other videos about the other types of central lines, and I'll see you back here real soon on Nursing School Explained. Thanks for watching.